good morning to all of you. Once again, very warm welcome to another Dutcham event today on this Thursday morning, but probably Thursday afternoon for a few of you, because we have quite a few people today joining us as well from the Netherlands. So I would say welcome to all of you, both here in Brazil and in the Netherlands. I think we have again a very interesting topic today to put on the table. Probably all of us already had some moments where we felt a little bit anxious, a little bit in fear. We experienced a bit of stress. I think especially these days. So it was more than time, especially now with Corona, to put a topic on the table and to have a nice debate with a few experts able to talk about that. And once again, I'm happy that I'm not alone, because I have a very nice cast today gathered for this debate. First of all, allow me to welcome my guests, and maybe I can ask them to open their microphone and open also their video, so we see already some faces coming up. And very nice to see that we have only women today. It looks like women are much more comfortable of talking about health and well-being. Let's see. First of all, allow me to welcome Dr. Daniella Kerbauy. She is a hematologist from training. But besides of that, she's also a specialist in clinical pathology. But she has been working for the Grupo Fleury since 2012. And besides of doing a lot of manuscripts on transplantation, blood in her domain, she has also been doing quite a lot of surveys recently with the Grupo Fleury on mental health. So Daniella, I'm very happy that you're willing to join this debate, to have some insights from the side, also from the medical and the clinical point of view. Secondly, I would like to welcome an ex-tax specialist for more than 15 years, very dedicated to tax, Dani Plesnik. She has been based in the States for many years, but we're very happy that she's back in Brazil. Peggy. And not in the position of a tax specialist today, but for sure in the new era that she has been for a while now, and cultural diversity, development, well-being, mobility, recruitment, a lot of things, all of that within Deloitte, and very happy to have you, Dani, as well into this debate. Last but not least, I also would like to welcome Ammara. Ammara, she is based in the Netherlands, straight from Amsterdam, joining us today on this panel. Ammara is a typical HR professionalist. She has been working for more than 8 years in HR domain, and for I think more than 3 years now, Ammara, at a top employer institute based in the Netherlands, a senior HR auditor, talking to a lot of companies, analyzing a lot of companies. So very happy to have your insights as well from a company perspective. Now, having said that, I see that already a lot of people joined the virtual meeting room. And as I introduced already, stress, fear, anxiety that people have been having or facing, it's not new, right? It has been there already for a while. I think over the last few years, we've been seeing an increase in the number of burnouts, in the number of stress situations on the job. But before going to the workplace, allow me, Daniella, to address the first question to you. Where does all this stress, where does all this burnouts, depression, where does it come from a clinical medical point of view?
Well, I think you all know what does mean VUCA. So we're living in this environment even before Corona. It's been something that we were experiencing, and certainly stress plays a major role when you think about stress and you think about demand and also performance. The balance between demand and performance it has a lot to do with the mental disorders. And one thing that I was reading yesterday, only a third of patients that are diagnosed with a mental distress is adherent to treatment. And this is something that tells a lot about mental diseases, mental entities. First, you have to realize that we have them all underdiagnosed. That's something that we, not only because it is something that needs an approach, a physician's approach, in order to have a good diagnosis. What is sadness and what is depression? How you diagnose depression and distinguish that for a moment of sadness that has a primary cause that does not impact you or you functionally, and on the other hand, depression that is an entity that needs medical care. So you have that, and we face that not only because of the difficulty of the diagnosis, but also because a lot of taboo. We don't discuss these things. We are not open to about that, and this has a lot to do with the moment that we face right now. And when you think about the medical field, especially among physicians, we've seen for the last 10 years an increase in depression, burnout, and other mental alcohol consumption and anxiety. Those are all entities that we've been dealing more often among physicians. And this is a topic that gained a lot of priority in the healthcare sector.
How does it, Daniella, how does it come? Because before going to an important topic like taboo, you already mentioned, but just one step back, how does it come? You notice that there is an increase of number of people that go towards a depression, towards a burnout. How does it come? Is it related to the pressure linked to the job, the expectations in life? How do you see that? You've been doing a survey on this.
Yes, one thing, when you think about performance and demand, there is a curve. And if you have too little demand, you may probably be a lot laid back and performance is not as, if you increase demand, stress starts to appear, but you can see top performers there with a bit of stress and a good amount of demand, and you can deliver a lot. But at some point, you have higher stress, and then the curve starts to go down when you think about performance. And you feel the symptoms of burnout, which are emotional exhaustion. It's one of the symptoms. Depersonalization, when you feel strange, when you don't recognize your feelings, when you think you're outside of your body, or anger and levels of anxiety that impact you functionally. So it is something that's real, and burnout specifically in the last 10 years got a lot of attention among not only in the healthcare sector, but all different corporate sector, in other sectors. And it's something that we have to be open to talk about. And work-life integration also, there are people that are satisfied with work-life integration, and if you think about, when you ask those people, it varies a lot. One that consider, oh no, I can work and my work hours, it fits well with my lifestyle, personal life. And for other people, it's different. And it has a lot to do with the personality type. When you think about burnout specifically, we have a lot of there are internal factors that predispose to burnout, and also the external factors. And among physicians, for instance, the need of recognition, the need of autonomy, the perfectionism, you don't say never no for work. This is a type of personality that is very prone to
more sensitive, huh? More sensitive,
very sensitive to burnout. And then you come to the external factors. That's the VUCA and now the Corona. That it's a perfect predisposition environment.
Yeah, to create more. Before making the bridge to the companies, just one last thing, adding on what you were saying, Daniella, is the situation, obviously, of Corona, I mean, has an impact for all of us. But does that mean that people that were not so sensitive before, that were not the type, let's say, of people who get stressed easily, that could now also with Corona face some moments of stress, anxiety, and potentially have depression, even though they were before Corona not at all vulnerable to that? Do you see that? Do you believe it's possible?
Yes, I think we are dealing with a big challenge when you think about work-life integration, and a lot of people working from home and how you manage all that. So it's the homeschooling, the housekeeping, and everything that you need to do. So work-life integration, it's just like one single thing. And this is something that can impact a lot. One data that I have, we have a psychological channel. So we have psychologists in the company, and we were always doing like on-site consultation. With the Corona, we started to doing telemedicine, and then we used teleconsultations. And when we looked at the consultations that were done between April, May, and June, 80% of them were related to the Corona
crisis. Yeah.
Crisis. Yeah. So it did impact a lot.
Yeah, absolutely. Brings me to Ammara. Because if we make the link of well-being and mental health, I mean, and talking about companies, I mean, I remember the time when the fruit baskets got on the table into the company, when it was even more excited when we had, the manicure, pedicure done on the office, or where we had the laundry done, taken care of. I mean, this was already a few years ago that started. Is this what well-being has been perceived in companies? Is it a fruit basket, or is this much more?
Hi, Peggy. First of all, I want to say happy to be here, really, part of this lovely panel. So I think we're touching upon the topic of employers' responsibility when it comes to employee well-being, right? But a little bit of a historical context. It's not entirely a new concept that employers are responsible for ensuring employee well-being. Decades ago, when we started off with works councils, for instance, one of their mandates was the health and safety of employees in the workplace. Then we went through this period of evolution into the legalities, the regulations. Fast forward to now, or let's say the digital era. Like Daniella very rightly mentioned, we're all always connected to our devices. There's so much competition. Things change so fast. You have to keep up with that pace. There are personality clashes at workplace. There are bullying instances. There's an increase in burnout. So all of that makes the employer's responsibility a lot more than just fruit baskets and coffee machines in the office. Why? Because on one hand, I think employers have already started to realize that productivity is very much directly linked with employee well-being. But on the other hand, we have to keep in mind that our employees, our candidates, are much more aware of the link between their well-being and the work-life balance that they should have. So it's not like an option anymore. It's not a nice to have. If you want to attract the right talent, it needs to be part of your EVP. It needs to be part of your total rewards, because that whole concept has become so much bigger than it used to be.
Does it mean then, Ammara, that the taboo, what was mentioned by Daniella before, that the taboo has dropped now, that we are very much open now, that everybody can talk about it? It's off the table. What do you think?
Well, if I were to give a very short answer, I would say no. I absolutely don't think that the whole stigma that has historically been attached to mental conditions or mental health is completely dropped off the table. But if I speak from what an organization can do as an employer, it's up to us as an employer to take the responsibility to create an environment, create a culture where it becomes okay to talk about these things. I'd like to share an example. It's a very simple one, and it comes from one of our top employers. What they did was, this is exactly what they wanted to accomplish. They wanted to take away that stigma of mental health. So they started with the top. Your leaders are role models. As simple as starting with making videos with their leaders who were specifically talking about mental health, who are specifically also referring to the support that the organization is providing to the employees. Like, hey guys, all of these things are available for you. We care about you and it's okay. So ultimately, eventually, as an employee, you start to get that feeling that, yeah, this is okay. Like, my organization talks about it. There's awareness. So if I go up to my manager and talk about this, if I go up to HR, talk about this, I'm not going to be like looked down upon. So there's always that first step that you need to take to eventually get to the end goal. But I think from an organization's perspective, those things do matter.
Okay, well, you mentioned it already, yeah. Culture, I think, from the fruit basket, which was just another benefit in the role of HR. I mean, we moved towards a change of culture. Well, when I talk about change of culture as such, I mean, I go to Dani because if there is one company that is absolutely king of managing a culture and a dynamic and taking care of their people, it's Deloitte. Dani, how do you see? Taboo or not taboo? Within Deloitte?
So nice to be among you girls. It's always a pleasure talking. I talked many times with Peggy and Ammara. Nice being with you all again. And thank you, Dutcham, for inviting us. Yes, it's still a taboo, right? And I'm eager to share more things that we are doing to see. It's just nice sharing what we are doing to see if more companies can keep doing it and if we can capture more ideas, right? But one thing that we didn't mention is a taboo in the company, but I also see some employees saying it's a taboo for themselves, right? So it's like the first phase, like it's not just we have the leadership talking about Ammara, and that makes a huge difference. But we also need to tell the employees that it's okay for them to feel like that. Because we have this moment in life, especially this economical moment, that everybody's kind of scared of losing their jobs and sometimes, and that triggers some emotions that they never had before. Like Daniella was talking about this VUCA. It was never this VUCA before, right? So if we reach to the top of VUCA, of like, we are not allowed to leave our houses. In history, we never had this moment, like anything like that. So this is new for everybody. So I have some employees that mentioned to me, we have all the programs out, like I will talk about them a little bit more later, but I have employees reaching to me like, oh, nice knowing that you have, 0800 that I can call. I thought I would never need it, right? It was just like there, because I'm this like top, strong, independent woman. I'm not gonna need it. And then, all of a sudden she realized, like, this employee, and always keeping confidential, is like, she was like, I never thought I needed, because that was not me, right? So it's just like that anxiety, that thing is not me. I'm like this professional, hardworking. So the moment that the person realized I may need help, and as soon they realize that they can reach out, the better, right? The quicker to help. So that's just something that I wanted to put in the table, because I know that's more coming.
Talking indeed about the quick change, because all of a sudden we came into this hell of Corona, right? I mean, nobody has seen this coming, not in this sense. How did Deloitte tackle this? Because you already had a lot of things on the plate, but are there specific things that you just accelerated, that you put in place at Deloitte the moment that Corona attacked us here?
So, and I'm dealing with, I'm like breathing hard. And I said that Ana Maria said that meditation helps because there's like construction in my building right now. So if you feel that, I take a deep breath and just keep talking. We all had computers, laptop, right? So moving physically to our houses, that was from one day to another one. That was not an issue. We did have a medical care team. So the thing that we were able to do is just change the focus, right? And instead of just having the people go into ambulatory in the company, let's just make webcasts from them. And the beginning, I remember the webcasts were like how to use, alcohol gel, we were not even talking about masks, right? That came like, it seemed like a year ago, but it was like maybe a month ago that we were out talking more about using. But it was like, can I leave the house if I go to the grocery? What was like the cares that I need to take? So we had all the medical team because there was so much fake news. And then we wanted to ensure our team that they had this curated information. That was the first, right? So go home and we have the medical team supporting you with the information. That was the first stage. And then the second stage, right away, we mentioned like the leadership needs to be nearby. So early check-ins with the team. Can you hear that? It's awful. Early check-ins with the team, right? Talking points. How do you organize the team building? Because we work a lot with teams. How do you organize that in a virtual, 100% virtual place? What can you talk about it? And then, and I don't know, Peggy, if I can start now with all the things that we did. So we make the shift, right? Mm-hmm. And then we talk more about feelings. Mm-hmm. It's always hard in a company to talk about feelings, right? Yeah. So we had the CEO sending emails daily to the team. And it was not just about numbers. How is the company doing? It's important to say how the company is doing because that affects everybody's life in a way, like, am I safe or not safe? Am I secure? Am I going to lose my job tomorrow? That's a huge thing. So we mentioned that too. But it was like, I'm too, as CEO of the company, adapting to my house, having to clean my house and having to deal with all of this.
Comes a bit down on communication. We'll talk in a second about that, Dani. But I'm going back to Ammara because what I'm wondering as well, is this a universal thing? I mean, you've been talking to so many companies in different countries. Is this a universal thing, or is it just depending also on the country? Is it, for example, worse in Brazil? For example, is it different in Brazil?
Yeah, for sure there are differences from even one country to another, from one region to another. But generally put, I mean, just to put some context, well-being, the concept of holistic well-being, it's almost like you follow a maturity model. They're like basic health and safety, then you add a little bit of more advanced level where you start talking about mental health, all the way up to where employee well-being is eventually part of like the culture of the organization, when it's really integrated and there's no two ways about it, right? Now, if I were to compare generally, let's say if I look at Europe, I would say based on our data and what we see when we talk to our clients, we see that maturity level is maybe a little bit higher. For example, in Europe, we see organizations have started to lay more emphasis from the business perspective, right? So well-being is looked at as a business imperative. So there are steps being taken to really hold leaders and managers accountable for employee well-being. But that's not to say that there aren't things happening in countries like Brazil. Of course there are. In the past few years, we see there has been increase in communication around well-being. So there have been addition of programs like mindfulness, like there's been anti-bullying policies in place, but also things like, at least I think if you look at our data, 40% of the top employers in Brazil also have a burnout recovery program, which is probably not that easy to come by. But what I'm trying to imply is that there are steps being taken pretty much everywhere, but maybe the maturity level varies from one region to another.
And maybe, and then I come to Daniella. I mean, I've been here for 3 years. I mean, if I need to say something about the Brazilians by far, then it's that they are very open, very, very positive, always smiling. Fica tranquila. I mean, everything will be fine. You know, this is became the sentence of my life in the meantime. Fica tranquila. But are they so tranquila? I mean, isn't that, you know, a part of the Brazilians, that they don't stress so easily because they will see, vamos ver amanhã.
Well, I think it is part of our culture, yes. And we are also very social. So at this moment, it is impacting us as much because we like social distance. Yeah, no touching, no
talk anymore. Yeah.
So it did impact a lot. Even we are here in Brazil, and the fica tranquila type of behavior. It varies. I think it varies. And I agree with Ammara. I think even here in Brazil, we see the maturity level of companies vary a lot. When you go to the healthcare sector, this is also true. And for physicians, and being, and Dani mentioned about the taboo. The taboo, it's within us. And when you see the papers in the literature, the number of physicians that respond to surveys that about mental health, it goes to 12%, 17%. We did a survey with our team late 2018. We got 43% of respondents, and it was huge. We had 1,400 physicians, more than 600 responded, but we had to talk a lot about that. So look, communication, it plays a big role, and so we have to talk about it. It has the leaders need to talk about that. It has to be it has to be in your speech. Yeah. It's something that you really care. And there is one thing, when you think about the business perspective, as you mentioned, so we take care of patients. Every patient experience had become a big issue in the healthcare sector. And then we started to work on how we need to deliver the best experience. How come you're going to deliver a good experience if you don't take care of your professionals' well-being? So that's the big, I think, was the big motivation also. Mm-hmm. You know, even in medicine, now we have wellness specialties. So you can, we always look at the disease. We always study pathologies. And we haven't been very attracted by the well-being. It was like take for granted that you're fine, you know. And now we know that, yes, mindfulness can work for you. Yoga can work for the other one. Going for a bike trail, it works for another one. So yes, you need to take care and understand what it value for you, for your own well-being. And it's not easy to find. It's something that you really need to talk more about and understand what is good for you.
So also for the Brazilians who are that positive and that always tranquila for the future, I mean, even for them, it's important. Brings me back to Dani in terms of actions within Deloitte. I mean, once again, I think it moved away not only from the table of HR, but I think it has become now a responsibility of all of them. You already talked about the leaders, lead by example. Can you share a bit on that within Deloitte. How do you see that? How can a leader be exemplary on taking care of the mental health of his employees?
So I would just give one step back and say one thing that, because we can as a leader mention about it, but then the employee feels the need, and if he doesn't know how to deal with it, that's an issue, right? So first of all, it's important to have any program that is like, even if you hire a vendor that can provide support. So I would just say that because we do have a 24/7 channel, and it is not just call, it's actually chat, because we don't have privacy anymore. So I don't want my husband to know that I'm having a panic attack. So that's a huge issue on the model of things that you have available in your company, right? If you don't have that, don't do anything. Like not doing anything, it's even worse, right? But having that is a very important thing. It's a good investment. One step, and now Peggy talking about leadership. So we were saying, right, CEOs, they are the top. So this perfect person that can deal with anything. He came into a call with us about anxiety. And he was mentioning, like, I do routinely check myself, the level of anxiety that I'm feeling today. Am I green? Am I yellow? Am I red? Once the CEO mentioned that, I was like, whoa, if the CEO that's like this perfect, handle the 5,000 people company in this role of economic issues, he's doing that. So I can do that myself. So it's like this, he's allowing us to do that too, and that being okay. So that was huge. And like, so he was sharing with us the toolbox, right? Daniella was saying a little of examples of the toolbox that you can use to help yourself to deal with that. So he was mentioned that, Ana Maria mentioned like a meditation. So one thing that we did and we called in was a meditation session. And that was the hit. Like everybody was wanting to know more about it. We have a meditation app that we provide to all employees. But the power of having 500 people together meditating, it was massive. So it was like first timers, people, they're like, oh yeah, I meditated like 240 hours. Like, wow, really? So it was sharing the experience and trying it out. And some people that mentioned that like the day after, I slept like a baby that I haven't for, many days. So it's just try out different things. Another thing that we did, so having the leadership saying that and allowing them to share what they are feeling, it was very important. One thing that I did since the beginning was having a virtual coffee with all the company. So we have weekly a virtual coffee, and like, okay, HR, talent, right? What we're going to talk about? Career, we're going to talk about how to do e-learning. No, we're going to talk about gratitude, empathy. We're going to talk about living in this VUCA role. We're going to talk about a purpose in life. We're going to talk about, so unconscious bias, why not, right? So I think we started having this conversation, we heard from people that never felt like they had a voice in the company. And that tackled two issues. It's okay to talk about vulnerability in a company. And I love Brené Brown. Like, I love her. And another thing is everybody felt like they had a voice and a sense of belonging. And in a moment like that everybody's locked in their house, to actually have the feeling of belonging to something, it was very powerful. And I'm going to stop now, Peggy, because if not, I'm going to just keep talking.
But it's interesting because I want to balance what you're saying with Daniella, who is as our doctor in the panel. I mean, Daniella, is this what works? I mean, how can we avoid, that people get depressed, get in this burnout? I mean, I know it's not a simple answer, but we've been talking about talking to each other. I know that you're very much into empathy. We discussed that before our webinar here. What is key? What should a company, how should our leaders react? What should they do to avoid that it gets to a burnout or to a depression? You have to put your microphone again on. Yeah. Yeah. Okay.
Dani mentioned a couple things on the toolbox that are very essential for that. And I will summarize like that. It's a balance between demand. When you think about burnout specifically, I feel that it's a balance between demand, autonomy, and social support. So when you think about social support, as Dani mentioned, you know, being there, the virtual cafe, the touch points that you make virtually, subjects that are interesting, that will attract everyone, something new, innovation, and also talking about empathy, gratitude. So these are elements that I put in the basket of the social support. And autonomy, it's a big issue among physicians. We need to have, it's when we choose medicine, when you look back, it's autonomy, it's how we work. Mm-hmm. And with all the changes that we've seen in the healthcare sector, mergers and acquisitions and the institutionalization of the physicians, it did impact a lot. So when you think about social support and autonomy, I think it's two things that you need to work a lot in order to balance demand and avoid burnout and other mental entities also.
Which is not easy, especially I think, Daniella, in a time like Corona, the autonomy, I mean, you have to let go of it as well. I mean, people are on a remote version now. You don't have the same proximity anymore with all your people that work for you. I mean, I think giving them the space and the freedom, as it is important, as you mentioned, it's not always that easy. I mean, it's a bit letting go, no, for leaders.
Yes, I think so. But on the other hand, if you balance your virtual meetings, if you balance communication, that plays a major role in this moment, you need to have everyone in the same page, and you need to talk not only about the business, how it's going to be the recovery and all that, but also how we can do things differently. We have been experiencing meetings that we had to go to a place and get everyone together. We would have 25 people there, and now we can have 100 people. Mm. So and people are engaging, so they want to be together. When you see the numbers of our virtual meetings, it's so good. When you see, I caught 59 there today. It's wonderful, you know. So it's something that we see, and not only I think the tools are helping a lot, but also they need to be together. Mm. It's the symptom, you know. We need to be together in this moment.
But it's human, Daniella, and I think we all hope that one day we can be really, really together again and hug and kiss again and and have drinks together. That would be better. I'm going back to Ammara. Ammara, do you see an evolution in how companies have been going through all of this? Did they change fundamentally? Did they change the way they cope with health and well-being?
Yeah, sure.
Did the crisis give them another push, maybe? I don't know.
Oh, for sure. Just to come back to the first half of your question, absolutely there has been an evolution. And I think that evolution is associated with employee well-being going outside of HR and becoming more like, hey, this is for the company. And it's not just some well-being initiative or program that HR came up with and everybody has to go and run in the park in the morning. So it's gone a bit beyond that. And you see that in mature organizations especially, you start to see reference to employee well-being in their sustainability reports. You see that in their external communications, and that are not necessarily employer brand related, but corporate communications. So communications that come from executives. I'd quickly share an example that I found very interesting from one of our clients as well. What they did was they made well-being, or like discussion about well-being of an employee, especially regarding work-life balance, part of the performance reviews. So what came along with it was a discussion with the manager every single time you sit down to talk about your performance. How do you feel about your work-life balance? Along with that was also preparation for the managers to prepare them to be equipped to handle those conversations. So there's clearly that needle is moving slowly, but surely. Now we come back to the crisis here. I think it's human nature, first of all, to once we face something, once we have lived it, we pay more attention to it. Because all of a sudden now, regardless of where you are, the approach to handling the pandemic in general was two priorities: business continuity, safety of the employees, right? That was across board for everybody. It's just that the difference is the organizations, and I'm talking about the top employers, our clients that we talk to, those that were equipped to handle it. For example, I can refer to Deloitte Brazil. Dani just spoke about having those apps in place, having that structure for remote working in place. So all those things, basic needs are there already, and it was easier for them to switch. But those organizations that were a little bit lagging behind now have that incentive and that almost like a need to, hey, we need to have something there in case something like this happens ever again. So absolutely, I think it will serve as a push for organizations to pay more attention to it. So let's call it a silver lining.
Now talking about these leaders, I mean, I think another challenge is, and well, not all leaders are, let's say, well equipped to do this kind of conversations, right? I mean, it still is a bit awkward, and I don't want to get into a gender discussion, but maybe men are a bit more uncomfortable than women to talk about feelings. I mean, I don't want to generalize this, but I mean, I can imagine that a few leaders have faced some difficulties, right, to talk about this.
Oh, for sure. I think, again, sorry, I'm just thinking of these examples that I've recently seen. And another one was, which made me really think, that we always think about, okay, how do we make employees feel better and, engage and everything, but we hardly ever speak about equipping our leaders to handle it. So it all becomes like making sure your leaders understand it's not what you're going to say, but how you're going to say it. And we have one top employer here in the Netherlands, and what they did was precisely for this situation, they came up with guides and specific training for the leaders and managers to actually teach them, like, hey, it's not really about what you're saying. Like, yeah, you can call somebody up and say, yeah, hope you're doing well. Yeah, duck, bye. But it's just about active listening. It's about how you're framing your words. And so I think it's very important, and if you've touched a very critical point there, that sometimes it's just that organizations don't pay enough attention to really equipping their leaders and managers to handle those situations.
I think, Dani, at Deloitte, you mentioned before in our pre-talks that you've been doing even role plays on training each other on how to deal with emotional discussions.
So I have a notebook full of notes, girls. Like, we're on fire today. So first of all, one step back, Peggy, autonomy, right? And this is huge for us too. And it links to empathy. So for example, I'm having a construction today. I have employees that have a baby at home. And if the leaders don't see that, one phrase that I don't say enough at Deloitte, we are not in the same boat, right? We are in the same sea, but my boat is really different. I have a husband that cooks, so he's cooking now for us. I don't have to worry about that. I have a nice apartment. I can lock myself in the bedroom. Yeah, I don't have an office, but so just seeing that we are not in the same situation. Some employees are sharing their living room with kids, with grandpa, with grandma, and that it's not easy. So again, having the flexible hours, right? If I have a baby, I may work better during the night, right? When the baby's asleep. And that will lower the level of anxiety of the mom. Isn't this delicious? So it lowers the level of anxiety of the like when you become a mom, you already feel like stress about, you know, am I keeping my place in my company? And then something comes up, and then you have a small baby that you need to pay attention to, and you cannot do the work in regular hours. So flexible hours helps a lot. So just autonomy, empathy, just think about the employee that you are talking about and what you're asking, that the situation surrounding is a little bit different, for one thing. Second, Peg, that you talked about, what we are doing in, what can we do in the company as like teaching the leaders, right? So we are doing coaching, trainings on coaching excellence. That's kind of like what Daniella said, right? So for when we are talking about coaching excellence, how do you train empathy, right? How do you do role plays? So it's like fake numbers, fake, you know, situation, and that's free. You can, Brazilians are very, very imaginative. So just fake a whole situation so you don't feel like you're exposing yourself. And then as I was doing the role model, I was the worst employee ever. So I just impersonated the hardest situation ever. And then I had one of my employees, you know, coaching me. And I was tough, right? I was a tough cookie. And then he was like trying hard. But then on the debrief, I said, if you try to understand my feeling, what was behind it, like how I was stressed at home, what the situation was going, maybe you would break me. You know, I would like be more easygoing. So having that, it helps a lot. And I'm going to shut down because you guys heard enough of this.
Daniella, that's well. We already had the noise on the back, but we didn't have the children or the dogs or the cats passing so far, or the husbands. I mean, this will be possible as well that we have this in the remaining 10 minutes. But by the way, towards the audience who has been following us since the beginning already, please feel free, guys, to pop a question if you have. I mean, we're still there, so we will love to pick up your questions as well. So feel free. I'm going back to Daniella. Daniella, I think you're also into inside of Fleury. You've been training and you've been working with your leaders, right? Even though that most of them, they're doctors, they're supposed to be very easygoing with this. They should know how to do this, right?
Yeah, we've been working with them since 2017 with a program that it focus on empathy. We did a work together with Cleveland Clinic, and that's when everything started. And so we've been training them in empathy skills and how you can potentialize and identify opportunities and to be empathetic. And it does improve a lot the experience of everyone, not only the patients, but the healthcare professionals and everyone. And the other thing that we've been doing is training our medical leaders for to talk about mental distress. So we did a training how you would recognize depression and burnout. What are the difference? What you should do? How you approach your colleague and give them support. So we've been doing that. I think what we started doing, we started talking more in the company about well-being. So we brought psychiatrists and psychological professionals to psychologists to talk and bring awareness of the theme. And after that, we did the training with our leaders. And then, because, you do the survey and use all the tools to identify burnout and depression in your population. And so what? If you don't have a plan to do something, I really question if you should do the survey. Because if you're not going to do anything with that, you better not do. And so we had a plan, and then we did a survey, and we've been talking about that. We did a lot of mindfulness during this period. Also, it was really good to see, and also the yoga, and so you need to address.
Yeah.
If you don't address the issue, you're not going to move on this
Daniella,
subject.
as a doctor, do you believe that companies have the capacity of tackling these mental health issues? I mean, don't you think that there must be also, in addition, some support from, let's say, the real psychologists? I mean, because, okay, we can create a well-being and we can listen to people, and we have coffee and virtual coffees and whatever, but don't you think at the end, I mean, there should be also some real medical support? Or is this a bridge too far, you think?
So that's what we did. So when we wanted to amplify empathy, we got together Cleveland Clinic as partner, and we did this project, this huge project. And when we talked about mental health, we got a support from Dr. Gataz and bring their team to work with us. And so even though we are in the health sector and we have a lot of physicians, it's not our core you need to have a specialized support in order to build a plan, to address.
I think that's also a key message, I think, to companies, to think about this plan, to think about the toolbox, and to really consider as well which kind of things they can add themselves as a company, but also which kind of things they should reach out to real professions, right? I mean, because at the end of the day, I mean, we're talking about mental health, and it's not so easy. I mean, unfortunately, there is not a display on people's heads saying what is really inside, right? That would be more easy. And also, I think that, like somebody in the chat box is mentioning, I think now everybody's under pressure. We have less and less time. We have to do more with less. So who is having time to dedicate to help people? Ammara, maybe coming back to you, do you think that there is also an evolution in terms of expectance of employees towards their company? Has that grown? I mean, do employees take this now for granted, that this kind of thing should be done by a company?
I think it's more and more, especially, don't mean to offend millennials, but I think it kind of started off with that generation, myself included, actually. But if I were to begin talking about the first step an employee takes to, or a potential candidate takes to evaluate an organization and decide to become a part of it. Hey, we still have that war for talent going on, so you need to keep those things in mind as well, because the skill sets of the future, the skill sets that are required now are not necessarily there in the companies. So we need to be mindful of that. So what are the people that are looking at your company needing or looking for? It's well-being, including mental well-being, that work-life balance, the flexibility, personalization. Those are not just hashtag words or trends. It's real. These are the things that a candidate is going to look at and try to identify what is the culture of an organization before they apply, before they make an application. They will do a whole search. Everything is out there on the World Wide Web now, right? Like, what are people saying about your organization? And then and only then they decide to come over. Now, if you move over to the employee, so one thing's for sure, that it needs to be part of your EVP. It needs to be part of your value proposition towards attracting the talent that you really want in your organization for your business to succeed. When we come over to the employees, there's no doubt that the awareness that the employees have about what it means and what they demand from their employer is absolutely much more than how it was a few years ago. So you do start to see employees going like, okay, I need to give time to my family. I do need to manage my work hours. So the expectations are definitely there. Now, how people are handling it is, I think, another sort of debate. And I think it's also something that varies in different regions. For example, again, not to make it a big point, but if I talk to our clients in Asia, it's a very hard-working culture, like long hours and everything. So their outlook usually is something like, how do you, if I ask them, like, why don't you take steps as an organization to make sure your employees are switching off after work hours, not using email? Their response usually would be something along the lines of, then how do you expect they would prove themselves? So that mentality still exists. I mean, let's call a spade a spade. It is the way it is. But the expectations are definitely changing, and I think the organizations need to realize that and try to adapt to those expectations, because there's more coming where that came from.
Yeah. Well, and I think, and that it's probably the last note I want to end up looking at the time, because obviously I can discuss for hours with you girls, but looking a bit at the time, maybe as a last note, I mean, obviously we're not out of this crisis yet. I mean, and well, a bit better already in the Netherlands, but for sure here in Brazil, we still have a bit of a long way to go, I'm afraid. How do you see the future overall in terms of well-being? And I would like to start with you, Daniella. Is this a concern for you that things will become even more challenging for the future, knowing Corona will not be gone for the coming months? And also, even when it's gone, I mean, how will we go back to the office? I mean, office will look like probably completely different than in the past. We will have lots more of homework to do, or a lot of people will stay at home. This will not help us, in terms of the mental health of people. How do you see the future?
Well, as a Brazilian, I'm optimist. And so starting from there, I need to realize that we're going to face a lot of changes. And in fact, this type of webinar that we just had, I think it's going to be more and more frequently. And we need to speak more about that. We need to share more. If you can do empathy training virtually, yes, we can do empathy training virtually. Once you adapt, yes, it's possible. So we need to be more active on this respect. We need to really bring your voice and act. But there are so many. I like the toolbox, the Dani's toolbox. There are several alternatives that you can address, but it needs to be in the companies. It needs to be at the executive level. It needs to be a priority.
It needs to be on the table,
Yeah.
And I think along the way we will probably need to learn from each other as well how to deal with it. Dani, short last note from your side.
Okay, I'm gonna try to be short and sweet. To be honest, it's super positive. I think we didn't choose this, right? I didn't choose to stay 3 months in my house locked with my husband. I feel like I need some time apart from them now. But then the thing is, and it's not gonna be just 3 months. We're facing more time, to be honest. This is an opportunity. I think that we create habits in 3 months, right? So I think now we are actually rethinking everything. Do we need to stay 2 hours in traffic to go to a meeting that's gonna last 1 hour? No, we don't. Can we do things more globally, right? Can we actually talk with Ammara that wouldn't happen physically if we were doing this here in Brazil, right? Okay, of course, Ammara, you can come anytime, but that wouldn't, like, we can exchange more. We gain a lot from it. We lose the hugs, we lose the kisses, right? But then we once we have the time to have that back. So I see this as an opportunity, as Brazilian super optimist, of like, what can we do better? And like somebody said, not just do more with less, right? But like, what is actually a priority? So what do I need? What we want from our people? And then what is just like, let's get together and talk about change, because people have a hard time changing too. And I like to be honest, if we don't talk about it, as soon as the government say we can go back to the office, even people don't think everybody is going to go back to the office and everything is going to be exactly the same. So I think we need to talk about it, Peggy. That's my, trying to be short, but I just wanted to make myself available to whoever wants to talk more about examples that we mentioned, what we are doing. I think doing nothing is not an optional. It's not an option, right? Try to do something. If you don't have the investment to hire somebody, a psychologist, not doing anything is not the best. Start with something.
Okay, thank you very much, Dani. Ammara, I want to close with you.
I just wanted to say to Dani, the first chance I get, I'm getting a ticket to Brazil. So you can't get rid of me virtually. But I completely agree with what the ladies have said already. And to you, Peggy, wanted to say that you brought up a really important point, and that has to do with bringing people back to the office. I think for organizations, if I had a message, I would encourage them to start thinking about that plan also, because your employees have been away from the office for way too long. They're now adapting to this situation, and bringing them back is not going to go like this. You need to work at those reintegration or reboarding of your employees, and that would vary and depend on your context, your organization. So just to highlight that.
I think this is a really nice closure and a very nice invitation for probably a next webinar, because then it gives me already an idea on the topic for the next one. How will we get back to the office? And then I'm not talking about physically, but in terms of how moving people in all kind of aspects back to the office and getting back to the normal or the new normal life, whatever that will be in a few months. Now, I would like to thank all of you for this almost interesting conversation. I think it was really fun, not only the preparation meetings that we had, but also to do this webinar. Thank you very much, girls. Dani, Daniella, Ammara, for being with us today. Thanks, also special thanks to Top Employers Institute, who has been behind the scene helping us. Victor and Gustavo, who are not here, but who have been helping us behind the scenes of putting all of this together. I mean, that was a pleasure as well. And then to the audience, obviously, I would like to thank you for joining us today. In the meantime, we have a real YouTube channel at Dutcham, so feel free to have a look, because we will be posting this webinar as well on our YouTube channel, open for you to review and to relive the discussion that we had here today. So thank you everybody for joining us, and stay tuned, stay safe, but stay connected, and keep all very healthy mentally and physically. Thank you very much. Thank you. Bye.
Bye.